Division of Nursing at Queen Margaret University introduced the Person-Centred Practice Healthcare Framework to bring together all of the work that I and other colleagues have been involved in globally on the development of person-centred healthcare. And what it does is it enables students at a master's level to study through an interdisciplinary learning different perspectives on person-centred healthcare, but to do that through this common framework around person-centredness. Person-centred practice is an approach to healthcare delivery that places the person at the centre of all decision making. And when we talk about person, we're talking about the patient and family and communities, obviously, but also the person of staff. So it takes into account the culture in which people are receiving healthcare and also the culture in which people are working to deliver that healthcare. And at the heart of person-centredness is the idea of humanising the healthcare system. The benefits of the framework are many, but primarily it is a recognised theory that brings together the different components of person-centredness in relation to the culture of practice, but also how people engage in everyday practice. It informs the different elements that people need to think about when they're planning practice, but also when they're organising services or when they're developing policy in relation to person-centred healthcare, with a focus on humanising the healthcare experience. It's particularly targeted at anybody who works within a healthcare context, but particularly those people who want to advance their knowledge, skill and expertise at a master's level of understanding. So you're talking about people who are working in advanced roles, who are working in leadership positions, who are developing curricula, or who are shaping healthcare policy and practice. Queen Margaret University has established itself as one of the global leaders in relation to person-centred healthcare, and the person-centred practice framework is one example of us doing that. But also we have the Centre for Person-Centred Practice Research here at Queen Margaret University, which brings together all of our doctoral work, all of our postdoctoral work, and all of the research that we're engaged in globally in relation to developing person-centred healthcare. So we have here a team of academics who are steeped in the theory of person-centredness, but also who are engaged in everyday practice in the delivery of person-centred healthcare, and who are committed to doing that in an interdisciplinary way. Currently, we've developed around 11 different pathways, as we refer to them within the framework. So each pathway represents an individual program of study, but the way the framework works is that everybody studies 2 core modules, irrespective of the pathway that they're engaged in. And then they choose their particular pathway. Some of those pathways are regulated because it leads to a registration with one of the professional bodies, such as the Nursing Midwifery Council or the Healthcare Professions Council. So for example, health visiting at school nursing, or art therapy or music therapy would lead to a professional registration. Other pathways don't lead to a professional registration. They're more professional development programs at master's level, and some examples of those are our public health and wellbeing pathway, or our mental health and wellbeing pathway, or the palliative and end-of-life care pathway, which we do in partnership with St. Columba's Hospice. The person-centred practice framework has been designed to enable people to study flexibly. So we have options for people to be able to study from a distance through our online provision, but they can also study part-time in flexible modes, so they can combine it with their existing work. But they can also study full-time if they choose to do that with us as well. So there are a variety of options that people can combine over the period of study for which they're registered.